Yep. Hi
Okay.
there. We can hear you.
Hi. Okay, so at Wendat, the project we chose for E-QIP was youth crisis assessments. Can you put the next slide for me, please? There we are. That's me and Deborah and Sherry. Unfortunately, Deborah couldn't join us this morning. So you can go to the next slide. So in December 2017 at RVH in Barrie, they opened 8 Schedule 1 beds for children and youth, but then quickly discovered that due to a lack of resources in the child and youth mental health system, there was no care pathway to get the 12 to 15-year-olds who are presenting at the emergency room at Georgian Bay General with acute mental health issues to go from the emergency room to those regional child and youth mental health beds. So there was no prescribed way to triage patients to the beds. So this is across our LHIN, not just in our sub-region of the LHIN, but we can only work on our sub-region. So Wendat is contracted by GBGH to provide the adult crisis assessments in the emergency room. So we believe the adult crisis workers could help with this problem. So next slide, please. Okay, so our problem statement was that there's no care pathway to 12 to 15-year-olds who are presenting with acute mental health issues to go from GBGH to RVH, and there was no timely access for crisis assessments for those 12 to 15-year-olds. So we are aiming to decrease the time that 12 to 15-year-olds on a Form 1 have to wait for a crisis assessment, and our launch date was October 31st this year. So next slide, please. So we used a fishbone. We started with our project team, so myself, Sherry, and Deborah, and then we got input from our whole crisis team. We found it very, very helpful to do the fishbone. It was a great place to start. The next thing we did was a process map, and we quickly learned that we needed input from the hospital staff because they're our partners. We learned there were a lot of steps involved in completing a crisis assessment, and there were a lot of challenges and barriers. A lot of questions came up that required further digging into data to get the answers to. And also we identified a lot of system gaps and root causes to the problem along the way. So next slide, please. So the root causes we discovered were a lack of resources in the child and youth mental health system, and also a disconnect between the child and youth system and the adult system. We have different funding streams and we don't always work together other than referrals. So this was really new to us to do this. Next slide. So the slide, I guess the run chart slide, it didn't, there it is. Okay, we just took a picture of our huge process map because we haven't finished 100% typing it up yet. So I guess I'm kind of going off script a bit, but this is interesting because this is something new. Like it's not something we already do and we were going to fix it. It's actually something that didn't exist in the system, these assessments in the emergency room. And it's something new we're proposing to do. So we haven't actually started doing this yet. This was a whole, the whole process was to help us decide, can we do this? If we do it, how will we do it? And who needs to help us? So that was the best thing about it for us, was just it helped us look at a real problem we were experiencing and how we could move forward. So I do apologize that we don't have a more detailed process measures, but this is where we're at in the project. So this is what I gave you, and it filled up 2 slides because it's huge. So, okay, so you can go to the next one. I know you can't even read it. So we don't have results because we haven't begun yet. Our target date is October 31st, but an update, I guess, of what's happened so far. In the summer months, our committee meetings do not meet, but we've started back at our mental health and addictions project team and our crisis and community project team. Those are committees of our LHIN in the mental health system. So this week I was able to go back to the crisis and community team, and today I'll be going to the mental health and addiction steering committee. We're going to be able to say, okay, since February we worked on this solution, this is what we can offer in North Simcoe. Is this going to work? And if everyone feels it's going to work, we will try to start. And it will also impact us in a different way, because we have a contract with GBGH to provide crisis services, so we will need to change our contract with the hospital. So next slide, please. So the challenges we experienced overall was definitely communication with partners, communication with the child and youth mental health system, that we identified a lot of system gaps that the project won't resolve. Like, it's a big problem and we can only chip away at a little part of it. And we have a possible resource challenge we won't know until we implement, because we're not adding any resources to our team. We're giving them extra work. So, next slide, please. Okay. We were most excited to take this challenging problem and work out a realistic solution that we can do. And we were most grateful to have the project just came along at just the right time, because we weren't even sure how to tackle this problem. And I don't know that we would have been able to do it without the E-QIP project and the team in particular. They really helped us figure out what was going to work for us and keep us focused. And we really did learn how to map out a problem and work on a solution through the project. And that's what we appreciated the most, I think. And I think that's the last slide, pretty sure. Or there more? Oh, what would we do differently? We did not fully understand the time commitment we would need, and it was difficult to fit in with our regular job functions. But I think that's true for every nonprofit. And the learning to map out a problem and work on a solution was the best part. And I think that's the end. I think. Oh, progress improvement. Okay, we have a long list of things we still need to do. We will be finishing up our process map. We need to add time to the steps and fine tune the steps. There's some data missing, and that's a challenge because it's not data we can access, it's data we need from the hospital and different parts of the system. We need to share a completed map with the hospital and then present the solution back to the child and youth system to see if it will work for them. And then if it's approved, we will implement it. And if it works really well in North Simcoe, we would be willing to share our solution with the other 4 subregions of the LHIN. Okay. I'm not sure, is that really the last slide this time?
That's really the last slide this time.
Okay, there you go.
Thanks so much for presenting that back. And I know you guys have done a tremendous amount of work, and it was certainly challenging, I think, to map out a very complex process. And kudos to you for involving, the hospital partners and other folks in those processes to really truly understand it, and to be so thoughtful around the measurement too. I know that was another hurdle, is how are we going to measure some of these things, and where's the data source going to be? But you stuck with it for what I think is a very, very meaningful project. And I know the timing too, and it took a lot longer than maybe expected, but I also appreciate that you didn't rush it to try to fit within the time frame of E-QIP, rather a realistic time frame for the project.
Mm-hmm.
And so I guess my only question is, over the next little bit, as you start to roll out those change ideas, we'd be continuing to measure and see what has an impact and how the system improves or not, and kind of modifying as you go along. Is that kind of the plan?
Absolutely, because I think in the meantime, while we've been all trying to figure out what we can do, there's a temporary system in place. So if the solution we've come up with doesn't make it better, then we have to think about why are we doing it, right? So we'll definitely be measuring very carefully.
Excellent. I also got a question here from a participant asking, has this process and this project improved your relationship with the local hospitals?
Yeah, yes, I would say yes. We had a good relationship to start with. There were always some challenges, but um, and it's interesting because our organizational structure is different from the hospital. So it was more about connecting with the right people, like not necessarily frontline, but we needed frontline input. So I would say we definitely have a better understanding of their part of the process, and they have a better understanding of all the steps we do to complete a crisis assessment. And now we're working on it together instead of each working on the same problem separately.
Great. Thank you, Andrea.
You're welcome.
So thanks to both of the presenters who've gone